All right, thank you. I was saying that's going to be a very hard act to follow, but we have a lot more to come. Welcome to the 2024 Department of Global Health graduation. I'd like to start with a land acknowledgement because we are occupying land today that's the traditional home of the Duwamish, Tulalip, Muckleshoot, and Squamish tribal nations. And without them, we would not have access to this working, teaching, and learning environment. So let me take this opportunity to thank the original caretakers of this land and acknowledge that they're still here. This is our 17th graduation since the department was established in 2007. And I want to extend a very warm welcome to all the Global Health graduates and also to your family, friends, partners, colleagues, everyone who's here today to support you. To all of you here with a graduate, for a graduate, let me also extend a heartfelt thank you. Please accept my deepest appreciation and all of those of us at the Department of Global Health, because this has not been an easy journey for our graduates, and your commitment to their success has made it possible for them to accomplish something amazing, and that's what we're here today to celebrate. So we'll be celebrating with all of you, the graduates of our 3 doctoral programs and our MPH, our Master's in Public Health program. You, our students, our graduates, I should say now, are about to join a network of over 2,000 University of Washington Global Health alumni, including graduates of our 4 graduate degree programs, as well as graduates of our undergraduate and certificate programs. Our graduates come from more than 20 different countries and are now working across 5 continents in more than 25 countries, and probably even more than that. They're working to improve health and eliminate disparities around the world. We are extremely proud of them and their work, and you are joining that group. Each of you who is graduating today will walk out of these doors shortly as a global health professional. You'll have new roles, responsibilities, and opportunities, and society will look at you differently and expect more of you. But don't worry, all of you are 100% prepared, and the global and local communities very much need your skills, your passion, your commitment, and your advocacy. This is an important time to be working in global health, and each of you has the tools to make a difference. So let's get started with the celebration. We're going to start by recognizing DGH students, just a few DGH students, and an alumnus who are the recipients of department and school-wide awards. So as your name is called, if you could please come forward and be acknowledged, and we'll take a photo before you return to your seat. So every year, the Department of Global Health honors exceptional graduate students who demonstrate a strong commitment to the field of global health. For the DGH Outstanding Student, awardees are selected based on a combination of scholarly achievement and academic contributions to the field of public health, as well as their commitment to public health, so beyond their research and practice work. And also with their leadership in public health. And this year's Department of Global Health Outstanding Master's Student is Dismas Congo Ouma. Thank you. Okay. Thank you. So, great. Okay, we can do the photo after. I'm going to say a few things about you, just to embarrass you, but you can stand. So Congo used his time as an MPH student to learn more about scientific inquiry, hypothesis testing, and research methods, and gain skills in academic leadership to address HIV, mental health, and other health problems of significance in his home country, Kenya, if you hadn't figured that out by his colors. During his MPH studies, Congo excelled in graduate level coursework in challenging areas across a range of diverse skills. He translated his extensive HIV research experience and clinical expertise into a thesis evaluating mental health among adolescent girls and young women who are participating in an ongoing HPV, human papillomavirus vaccination trial. Congo is a standout student noted for his intellectual curiosity, confidence, and drive to make an impact on the health of his fellow Kenyans, and I would say the world. Congratulations, Congo. Okay, now we get to do the picture. Okay. Congratulations. All right. So I already mentioned the characteristics of these outstanding students. I'm now going to switch to the DGH Outstanding Doctoral Student, and this year's awardee is Melody Wang. So when she was admitted to her doctoral program, Melody was the recipient of a UW, I'll just say UW, Top Scholar Award, where she worked as a research assistant. Congratulations. And analyzed complex longitudinal data and developed statistical code that would be used for multiple additional analyses. And then during the COVID-19 pandemic, she transitioned to a new role in which she worked as a project manager to lead a study on the development of novel point-of-care tests for SARS-CoV-2. Melody's current research and dissertation work focuses on decentralizing HIV services from clinic-based settings to community-based approaches in South Africa. Melody exhibits the attributes of leadership, scholarly excellence, and academic rigor appropriate for this award and integrates decolonizing methodologies into her work. Congratulations, Melody. You can do a photo. I think that's what we're doing. So, in addition to our Global Health awardees, we have two special School of Public Health Award recipients this year. We were thrilled to learn that the 2024 School of Public Health Alumni Impact Award recipient and the SPH graduation celebration speaker is Dr. Biraj Karmacharya. Yeah. Well, Dr. Karmacharya studied at the University of Washington, of course, because he's an alum, as a Fulbright Science and Technology awardee and received 2 degrees. He received a PhD in epidemiology in 2015, but then decided he needed to go do something in global health and joined us in our Master's in Public Health program in the Leadership, Policy, and Management track and graduated in 2017. Dr. Karmacharya is a public health leader in Nepal. He's an associate professor in the Department of Public Health at Kathmandu University of Medical Sciences and the administrative director of Dulakil Hospital. He founded and has been leading the Department of Community Programs and Public Health at Dulakil Hospital since 2006, through which he is engaged in developing and setting up innovative community-based health and integrated health and development programs. He has also been instrumental in advancing public health training and research in Nepal, leading the pioneering Masters in Public Health programs in epidemiology and in global health, and most recently launching a PhD program in public health at Kathmandu University School of Medical Sciences. Congratulations, Biraj. Thanks for coming. All right. Thank you, Biraj. We really appreciate your coming to this graduation. The next award is also a School of Public Health overall award, the Gilbert S. Omen Award for Academic Excellence. And I'm going to say a few words about this one because each year the School of Public Health selects 1 master's and 1 doctoral student from the entire school, from all 5 departments and several programs in the school for this Omen Award. And this is one of the school's most prestigious awards for students. They're selected on a combination of scholarly achievement, academic contributions, commitment to public health, and the positive impact that they've had on their community and their leadership. And this year, we're very excited to announce that Amanda Lee, a student in our MPH program, was selected. Yes. Amanda's work focuses on engaging with community perspectives to shed light on health disparities and improve access to equitable healthcare. Amanda is committed to advocating for systemic health system changes that address root causes and believes that effective and accessible health communication is essential. She has pursued health equity positions with local grant-making organizations and both US-based and international research projects. In these positions, Amanda has gained experience in a wide breadth of topic areas, allowing her to be an effective public health professional in a multitude of fields. Congratulations, Amanda. All right, okay. So let me congratulate, let all of us recognize, we've got Amanda, Barrage, Melody, Congo, one more time. Round of applause for their unique, impactful contribution. All right. Okay. So now it's my pleasure to transition to what all of you have been waiting for, which is our degree program graduates. I do, though, want to talk a little bit about the degree programs for all of you in the audience so that you understand who we have eventually marching across the stage here. So the Department of Global Health is home to 4 graduate degree programs, a Master of Public Health, 2 PhD programs, one in pathobiology, which is an interdisciplinary basic science program, and a PhD in global health metrics and implementation science. We also have a new practice-oriented doctorate, a Doctor of Global Health Leadership and Practice, which we call the DRGH, and it's welcoming its first cohort, welcomed its first cohort in fall 2021, and this is the first year that we're having graduates of that program, so very special. So this year it is our honor and privilege to celebrate the accomplishments of 52 graduates, 37 in the MPH program, and 15 doctoral students. 3 in the inaugural Doctor of Global Health Leadership and Practice, and then 4 in pathobiology, and 8 in the Metrics and Implementation Science program. So in the spirit of global, our 2024 graduates have joined us from all over the world. And I will just go ahead and read where they're from. India, Zimbabwe, Canada, Mozambique, Kenya, Nigeria, Mongolia, East Timor, Democratic Republic of Congo, Myanmar, Ghana, Nepal, Tanzania, Tajikistan, South Africa, Sudan, Peru, Rwanda, and of course, from all parts of the US. So wonderful to see all that. And these graduates have spent not just months, but years now dedicating their time to the 3 pillars that are the foundation of our department: academics, research, and service. And we are all so proud of the work that they've done and the dedication that has seen them through their respective programs. I'm particularly proud and grateful for the hard work and dedication of the faculty and staff who've advised them, mentored them, and just made all of this possible. I would like to give special thanks to our academic programs and student services staff for supporting the curriculum and students really from admission, not even before admission, selection, right through what we're experiencing today, which is graduation. Jennifer Sliker is our Associate Chair of Academic Programs. She's very capably led our academic programs during this last year. Jen, if you just want to maybe raise your hand. There we go. Todd Fabian, Assistant Director of Academic Programs. Julie Burnett, Assistant Director of Student Services. Savita Mukhtar is not here today because she's moved on to a new opportunity at University of Washington, Bothell, but she was a manager for PhD in Global Health Metrics and Implementation Science. Slamia Detta, MPH Program Manager. Will Atienza, MPH and Undergraduate Minor Advisor. Now you have to do that wooing for everybody. Ernie Leffler, Pathobiology Program Manager. We have Kirsten Green, Program Manager of Medical School Programs, International Experiences. Catherine Getz, Temporary Program Manager for our PhD in Global Health Metrics. Alicia Williams, Program Operations, Cindy Jha, and not last but absolutely not least, we have all of our faculty directors, many of whom are sitting right there, who I'll just name. For the MPH program, we have Deepa Rao, the director. Keshet Keshet Ronan, who's our Associate Director. Awa Kone, who's our Community Liaison and a pivotal member. Yes. And then for our PhD programs, Jenny Lund, Director of the program in Pathobiology. Penny Scher and Joe Dielman, I'm not sure if Joe is here, co-directing the PhD in Global Health Metrics and Implementation Science. And newest in this list of directors, Allison Drake, Director of the Doctor of Global Health Leadership and Practice. And finally, a big, big thank you to the APS team, again, overall, for everything you've done to keep everybody moving through this process. And now I get to transition over to Deepa Rao, MPH Program Director, who will take us into the next phase of our celebration. I'll leave this right here.
Okay, thank you. Hi, everybody. So I'll start off just by saying, family and friends of our graduates, I stand here in awe of this cohort of Global Health MPH graduates who have managed to complete our rigorous degree requirements that include 2 years of coursework, a thesis and a capstone, a practicum, and often outside work in the midst of the tumult of our world today. And for our students, this has often meant bravely rebuilding social networks in a new place, keeping focus in the midst of war, conflict, loss, illness, and natural disasters at home. They've also worked hard to find ways to maintain work-life balance. As you see, many people have brought their children here today to spend this day with us. And family and friends are often very far away. So I wanted to thank you, graduates, for your patience, grace, and perseverance. And let me tell you all, despite the odds, you did it. You did it. Let's take a moment to give yourselves a round of applause that you've all overcome it to make this moment. And let me tell all of your supporters here today, over the last few years of our program, we've heard a lot about our need for decolonizing global health to better serve our communities. And I have to say, it's been you graduates, our students, who pushed us to really think about how this can be done. I'm so lucky. I'm able to sit every week in our Rethinking Global Health course that I facilitate with my colleague, Awa Kone, with all of you thinking of ways we can do global health better. You've helped push us out of using a banner of decolonizing global health as a token phrase. You have helped us to really examine whether or not we truly honor our Global South partners in our work. And you have pushed us to put our Global South partners in the lead. You've helped us question our processes every step of the way. And I have to say, I was inspired and to kind of write down another lyric coming to this particular ceremony today. So in the words of Tracy Chapman, I have to say, don't you know, they're talking about a revolution, and it sounds like a whisper. And thank you for this, graduates. I can confidently say that you've made your mark here. Our learning in these spaces has truly been multi-directional. I've learned so much from you and your years with us. And I know these academic, clinical, and public health spaces are not made for those of us who come from the Global South, but thanks to you, you have made this your space. You've demanded it, and as your MPH degree shows, you belong in this space now and forever. Claim it. So many congratulations to you, graduates. Yes. Thank you for enriching our lives and our program over the years. You've made your mark here, and I'm so proud of all that you've accomplished. I'm so privileged to have been a part of your journey in public health, and I eagerly await to see all of you and what you'll accomplish in your futures, and the places you'll go. Please know that no matter where you are in the world, you'll always be a part of our MPH family. And to close, there are many people to thank. your friends and family sitting here today, or maybe watching live stream, your partners, children, peers, those of you who helped support you along the way. I'd also like to acknowledge our MPH team again, Keshet Ronan, Awa Kone, Salam Yadada, Will Atienza, and Julie Burnett, and our beloved faculty and staff sitting here who've helped to make things happen. So thank you. And I'll now introduce our student speaker for the MPH program, Sonita Saad.
Okay. Hi, everyone. Thank you for joining us on such a spectacular afternoon in Seattle. I am honored to be standing here and to celebrate the class of 2022's great achievement of obtaining a master's degree in public health. Hey! I'm so proud of myself and so proud of all of you. I never doubted that we could make it. Well, here we are. It is of my highest honor. I think I should put this here. Okay. It is of my highest honors to be standing here today with you all. It has been a journey, all right. I know the last 2 years have not been easy for anyone. They have especially not been easy for me. I went from being devastated for missing my family, from missing my warm country, to being devastated that my country is caught in a conflict, in a war. I didn't know if I will ever see my family again. And I am not sure if there is anything left in my country that is warm. And I know that a lot of you here had over these 2 years been constantly hearing me speaking about Sudan before and after the war. So just bear with me for last time. But I have to use this opportunity and this platform on this very happy day to bring some rain on our sunshine. I have to, not only because I am Sudanese, and not because I was raised, and not only because I was raised to love my country, to be in love with my culture and my family, but also because no one else is speaking about it. Because we are dying in silence across the African continent. We are dying everywhere in the world. We are dying in seas, trying to flee to safety. We are dying in deserts, being smuggled to safety. We are trapped in the woods in Ethiopia, in the rain, dying of snake bites. We are dying of hunger everywhere, in camps, inside or outside Sudan, in our houses. We are dying of shelling, stray or intentional bullets, in our streets, in our market. We are dying everywhere in the most horrific and inhumane ways. And all the world can do is tiptoe around declaring a famine in Sudan, trying to hide when in Palestine. We are dying of grief and heartbreak, mourning people we lost back home and across the world, family and loved ones that we couldn't bury or grieve properly and together. We no longer remember what they looked like. They are now just memories, just like my country. It's now just a memory. And I know that many of us, my fellow students here from across the world, are carrying this grief and heartbreak. I see you, and I'm sorry for your pain. I wish for once that we will stop the death and the pain instead of waiting for the bombing dust to settle, waiting for the blood to dry, and then calling countries out that are complicit in these atrocities. The United Arab Emirates needs to stop arming and supporting, and need to be held accountable for arming the rapid support forces in Sudan. I don't know how you all feel about the current state of the world, but I think maybe we need to move from speaking about decolonization in classroom and actually decolonize our world. Decolonize Sudan, decolonize Yemen, decolonize Palestine, decolonize all the countries where people decolonize all the countries where innocent lives are being lost because of greed over land and resources, greed of people who already have too much. I wish the world would stop treating people like me as resilient and strong when in reality we are traumatized. The world is desensitized to our pain and grief. And by now, I think we as well are becoming desensitized. Yet, I am internally and truly grateful to each and every one of you. I am truly grateful for my colleagues, my friends, my chosen family, my faculty. I am grateful that I had this world to hold me strong, to hold other people like me who are going through stuff like this, for what's happening in the other world, so that I can support my family, so that I can stand for them, for my country. I am grateful for each and every one of you. To the DGH faculty, staff, advising team, I quite literally could not have made it without you, without Julie, Salam, Will. Thank you so much. I am sad for the upcoming cohorts that they will not get your great support. Thank you. My colleagues who couldn't understand what it's like to lose your home, to lose your country, to lose your land, to lose your security. My colleagues who stood here for me in every way possible, who are here for me, thank you. I am truly honored to be here with you. So my lovelies, I hope you go out there with these great degrees and you make the change in any way or any form, any change you believe that should be there. I don't believe that we should let the world gaslight us into believing this is how it should be. This is not how it should be. This is not right. This is not fair. Thank you.
Thank you, Sanita. We'll now acknowledge the MPH graduates. So we'll have our staff and our faculty for the MPH team come up to the stage. Salam, I believe your name reading, right? Come on up.
Thank you, Will. Okay, I was going to look for you, Will. Good afternoon, everyone. My name is Salam Yareta, and I am the program manager for the MPH program. And it's been an honor supporting you all along with the MPH team. And now we will start. If you graduate, if you could please stand and move to the aisle to the right. Julie will direct you to come forward when your name is announced. Please shake hands with program leadership and return to your seat. Thank you. Yes, in alphabetical order. Thank you. All right. Before I call your name, I would like to honor and acknowledge our MPH graduating students who could not make it in person. So I'll call their name. Once I finish, please give them a round of applause. Robert Haynes, Parashar Kadka, Jeremy Mendia, Marilyn Nyabuti, Rachel Reinhardt, Frida Mboshono Theophilus. All right. We'll start with Amber Ahmed. Oh, just picture. Wait, did you take a picture? Cynthia Auma. Jacinta Ifunanya Azi. Uri Batar Surain. Lydia Bukonde. Nuno Alberto de Jesus Jimenez. Keely French. Susan Glenn. Hold on, somebody's missing. Oh yeah, Diana Lalika. Oh, okay. Amanda Lee. Irene Mary. Sarah McCoy. Mehroj Muhiddinov. Stanley Mugambi Ndwiga. Luyanda Ngongoma. Gloria Nyandaya. Heng Pew Toot. Patience Binambiba. Jaman. Timilin Toye. Sandra Urusaro. Helen Mora Okinyi. Desmus Congo Ouma. Tierra Ranson. Sonita Saad. Arancha Sanchez Boluarte. Joseph Sila. Inamialu Mary Jane Okogbuzo. Ben Ocheng Odhiambo. Kalitra Welch. Amelia Grace Wilkerson. Please give them another big round of applause. I now invite the Program Director of the Doctor of Global Health Leadership and Practice Program, Allison Drake.
Thank you. Well, I'm very honored to be here today to represent the very first graduating class of our inaugural Doctorate of Global Health Leadership and Practice degree. We have 3 graduates this year, and since it's a new program, I just wanted to say a few words about it because it is the very first degree program of its kind anywhere in the world that we know of. These graduates have decided to come to the University of Washington, start this brand new program that we honestly didn't know how it was going to work. They left amazing jobs, opportunities. They are mid-career professionals who come with a wealth of experience and expertise and took a chance to come here to expand their thinking, continue their training. And I'm so excited for all of you to go back out into the workforce and to be leaders in your field. These students took a very difficult first year of intense coursework while maintaining other positions in order to fund their education over the first year. And then were tasked with basically finding 3 jobs, just over a 2-year period to try to finish their degrees. They all did this with just amazing grace, persistence, perseverance, heart, dedication, and also just so much generosity in your ability to come back to the program to tell us what you needed, what you wanted, and how we can do better, and how we can support you in the future and for your cohort. I think it's so amazing to watch all of you as a cohort, to get to know you in this last year. I love to see your fellow cohort members here to support you, those of you who are, in the years coming behind you, and those who are finishing in the next few months. You all have amazing roles outside of this program. You are siblings and parents and sons and daughters. And I recognize the difficulty it is to balance all of these other roles while embarking on a very challenging and I hope rewarding degree program. So congratulations to all of you for taking the leap of faith to come here and do this with all of us. You all are going to go out into the field and become leaders in places that are missing this element in organizations. People who have the experience, the wealth of knowledge, the practice to know what it takes to really implement a program, to figure out which priorities are worth investing in, which maybe are not, or which need to be deprioritized. You have learned all of these skills within leadership of how to effectively run teams. You have familiarity with some of the research methodology in order to evaluate the things to invest in. And I'm so happy that you are all here today with us, with your families to support you and your friends and your cohort to just celebrate this amazing accomplishment of 3 years of very, very hard work. I also want to acknowledge the staff and faculty who have come along with us on this journey. So we've had the APSS team to help guide all of us in figuring out how this degree program was going to operate. And I also want to especially recognize Nancy Puckheimer, who was really the initial leader of this program. Nancy cares so much about this program and seeing all of the graduates, all the students succeed in this program. And I'm just so grateful for her leadership, mentorship, vision to launch this. And I hope all of you have continued relationships with Nancy throughout your careers and see her as a mentor to help guide you as you continue. I also want to thank Judy Wasserheit, who also assisted Nancy in these efforts. And also the core faculty who really helped you in your coursework to really guide, what does it look like to do a leadership practice experience? What is a meta project? And the meta project is like a dissertation equivalent, but we had to learn what those things were along the way. So I'd like to thank, in addition to Nancy, who was core faculty, Nancy Campbell, Stefan Victor, Melissa Mugambi, and Sarah Masuko for all of your efforts to help our students continue to learn along the way and all of your mentorship. And with that, I'm going to introduce Anwar Parvez Saeed to come up and say a few remarks on behalf of our inaugural cohort.
Thank you, Alison. And I don't have a speech, and you are wonderful articulating whatever you said. But I just wanted to, when Alison said that they brought us here for this inaugural cohort, we felt like guinea pigs, honestly. And they did all kinds of experiments on us, reshaping and shaping and reshaping the program again and again. But I'm now confident that the foundations on which it was built, the practice-based doctoral program of its kind, and now it is, I think, well prepared, and anyone, I think, can just get into it and do it for themselves. And one of the best features of this doctoral cohort or doctoral program is the leadership and practice experience. What they did exactly were chose 6 people from all different parts of the world, and they brought us here, all mid-career professionals like us with gray beard. And they made us sit into the classrooms and made us took 18 credits in a quarter for 3 quarters. And it was more than enough for all of us. Fiona and Raquel is here. And then they sent us to the field. By field, I mean they sent us to real organizations. And I'm proud to say that all of us worked for United Nations, World Health Organization, not only in headquarters, but also in regional office and country offices of World Health Organization. We were part of all big events when it came to World Health Assembly or regional committee meetings and all that. And we felt like we honestly contributed to the real change in the world. So I think this is the best feature of the program, that they will make you learn the basic sciences again. And then when you go to the field, you feel prepared to actually contribute to the real world. So thank you, all of you, for actually making us part of this community of University of Washington. And we enjoyed every bit of it. Thank you so much.
I have heard this term guinea pig referred to a few times, and I actually like to think of it more as pioneers. So you're all pioneers. Okay, so next I would like to introduce the graduates. But first I'd like to explain hooding. So the hooding ceremony symbolizes the transition from student to colleague and the scholarly and professional achievements of the graduate. So I would like to invite Nancy Puckheimer and Todd Fabian to the stage to read the names of the graduates.
All right. Hi, everyone. I'm Todd Fopping, the Assistant Director for Academic Services. I would like to invite the DRGH students to stand and move to your left, please, and come down to the front. And just to explain how this is going to work, once your name is read, I will also read the title, and committee members, you will shake hands with Nancy and Allison. There will be a photo of your hooding and a photo of with your mentor as well as you go. So keep coming down. Mentors, when you hear a student's name read, please rise to join us. Okay, first up is Raquel Sanchez. Yeah. Okay. Meta project title is Optimizing Multi-Sector Partnerships to Accelerate Equity in Global Health Initiatives. The chair is Britt Yamamoto, and Gabrielle O'Malley will be doing the hooding. There we go. Okay. Thank you, Raquel. Next up is, okay, here comes Anwar Parvez Haji Abdur Rashid Saeed. Yeah. Title, A Collaborative Approach to Combat Antimicrobial Resistance Within Communicable Disease Programs in the World Health Organization's Eastern Mediterranean Regions. Chair Judd Walson, hooding by Stefan Victor. Okay. Thanks, Anwar. And finally, for the DRGH cohort is Fiona Vumbugwa, who while you notice these on-point shoes, here's the title, Strengthening Health Information Systems as Part of Building More Robust Healthcare Systems to Achieve Universal Health Coverage in Low and Middle Income Countries. Chair is Carol Feldacher, and hooding performed by Scott Barnhart. Okay. One last round of applause for the DRGH students. Okay. And next, I would like to invite my colleague, Jenny Lund, who is the director of the Pathobiology PhD program, to the stage.
Hi, everyone. I first wanted to say this is a real pleasure and honor to be here today on such a celebratory occasion. I think we don't take enough time to celebrate and feel joy these days. And it's great to feel like my face hurts a little bit from smiling today, because that doesn't happen very often anymore. So I'm a professor in the Department of Global Health and also at the Fred Hutchinson Cancer Center. And I'm the director of the Pathobiology PhD program. And so I'd like to share a few brief words about the program before we celebrate our graduates. So the Pathobiology PhD program is a laboratory-based science program with a special emphasis in host pathogen interactions and diseases of global health importance. Through basic research, our intent is to identify targets for intervention in or prevention of disease. In addition to challenging coursework, our students develop a novel research hypothesis that they rigorously test through hours and hours in the laboratory. Our training is designed to prepare our future scientific leaders with the ability to respond to disease challenges that impact global health. As these unprecedented past few years have demonstrated, the necessity for rapid development of accurate diagnostic methods and effective and safe therapeutics and vaccines is indisputable and life-saving. And we believe that our outstanding graduates will be at the forefront of devising strategies to improve global health through basic science research. So congratulations to our pathobiology graduates. We celebrate your dedication, your perseverance, your passion for global health, your scholarly achievements, and your success in completion of the PhD degree. I'd also like to extend my gratitude to all of the people that have been named already, as well as Ernie Leffler, our program manager, who's made sure our students have registered on time and met all their milestones and got through the program, as well as our mentors within the pathobiology PhD program and beyond at the University of Washington, who have contributed to your training and your success, from your dissertation committee chairs and members, your faculty instructors, your lab families, and other trusted mentors. So next, it's with great pride that I introduce Alyssa Brokaw, who is our pathobiology student who will be giving a speech. So Alyssa has proven herself to be an outstanding researcher and has published 11 manuscripts throughout the course of her PhD work. And bear in mind, our requirement is to have one. So she's gone above and beyond, all while making really important contributions through her research on Group B Streptococcus. So I'd like to invite Alyssa to say a few words.
First of all, thank you, Jenny. That was incredibly kind. In late January of 2020, my husband and I were walking along Fifth Avenue, talking about the same thing that everybody else in the world was talking about at the time. As the monorail rushed over our heads on its way to the Space Needle, he remarked that the few cases of COVID-19 here in Washington, which were the first to pop up in the US, were probably nothing to worry about. We thought Zika, swine flu, bird flu. News outlets were kind of drumming up confusion, and this virus wasn't going to be any different. Initially, I generally agreed with him. Of course, it warranted our attention, but no one needed to start hoarding toilet paper quite yet. Almost exactly a month later, we were rounding the same corner where he'd decided there wasn't much to be concerned about, and we passed a tent covering a pop-up testing center. Pandemic had become much more than the name of everybody's favorite board game. We wore our masks nearly everywhere, and the city was beginning a mandatory lockdown. COVID turned out to be something real. For most of us celebrating our graduation today, this strange and worrying situation unfolded as we were in the midst of our studies. The world was pausing, and we were thrust into a nervous uncertainty at a time when we couldn't afford to slow down. I imagine we all felt compelled to work harder when watching the events unfolding around us. 2020 ushered in something strenuous and challenging, but I think in a way it presented us a uniquely valuable test. Aspiring researchers wearing masks on their way to the lab, having their temperature checked at the door, all while listening to the world's take on the science and the medicine that we strive to understand and to further. We experienced the pressure of the real thing and achieved quite a lot despite it. We were shown, or also reminded, that people without our specialized knowledge require us to be accessible and confident in our advising. And we've been taught many lessons, and far more than we could have anticipated was expected of us during our time here. But we've arrived at this milestone regardless. Very likely, better researchers and better ambassadors of science because of those tests. It's important to note, though, that we didn't achieve all of this on our own. We had the guidance and example of adaptable and experienced mentors, people committed to our success, fellow scientists who are eager to share their knowledge and to see us grow, the excellent faculty and staff in our department, our coworkers and academic peers, our family, our friends. We've been truly fortunate. With all these people beside us and all of this experience under our belts, all the long hours of our own hard work, we have reason to celebrate and reason to have true confidence in ourselves today. This is a moment of excitement and of reflection, a time to express our gratitude to the people who have helped us. And there's so much ahead now, a lifetime of opportunities to make use of everything that we've spent years learning, years and years, sometimes it seems. I'm more than hopeful about all that's in store for us, and I'm happy to have made this journey alongside you all. Congratulations.
Thank you so much, Alyssa. So at this point, we will be recognizing each of our pathobiology graduates this year in the hooding ceremony. So I'd like to call up Ernie Leffler, our program manager, who's going to announce each of our graduates.
Hello, everyone. Okay, I have a little script to read here, so let me get through that. So the graduates, please stand up and move to the left of the aisle, so the three of you that are here. When I announce your names, I want you to come forward and initially shake hands with Jenny, and then hand your hood to your mentor, who will place it over your head, not on it. 2 photos will be taken, one of the hooding and one with your mentor after you're hooded. Please return to your seat after the hooding. And mentors, please come forward when I call your student's name. But first, there is one of our students who isn't here today, Joy Twentyman, but if she's out there watching, hi Joy. And she was mentored by co-mentors, Michael Emmerman and Molly O'Handley. So welcome to, congratulations, Bill. So first, let me call forward Alyssa Brokaw. And Alyssa's chair is Lakshmi Rajagopal. And Alyssa's dissertation title is Roles of Group B Streptococcal Membrane Proteins in Virulence and Protection. Next, I want to call forward Christina Edwards. And she's being hooded by her mentor, Andy McGuire. Christina's dissertation title is Immunicity and Protection Mediated with Next Generation EBV GHGH Vaccines and Non-Human Primate and Humanized Mouse Models. And last but certainly not least is little Joshua Ivy. And he's being hooded by his mentor, Tom Hahn. And Joshua's dissertation is a mouthful. Let me try to get it right. Determining the major genetic regulators of Mycobacterium tuberculosis-induced cytokine expression in monocytes and macrophages with a cellular GWAS. And let's give another big round of applause to our graduates. And now I'd like to call to the podium, Kenny Sure.
All right. I promise you the dissertation titles will be easier for our group. DGH leadership, faculty and staff colleagues, family and friends of our student body, students, and especially graduates. I'm delighted to be here today on behalf of the Doctor of Philosophy in Global Health Metrics and Implementation Science, which I co-direct with Joe Dielman, who couldn't be here today. Today, we recognize the achievements of 8 graduates who will be joining our 46 previous graduates who are now furthering the fields of metrics and implementation science across academia, ministries of health, multilateral agencies, funders, and other leading global health institutions. The achievements of our graduates are not to be taken lightly. They have passed through a uniquely rigorous program that included, at a minimum, 2 years of methodologic coursework, defining and designing a 3-aim dissertation, defending their proposal, all culminating in 3 publishable manuscripts. This year's graduates have applied their skills across diverse areas of research to describe the burden of disease globally, as well as develop, implement, and evaluate interventions that address this burden of disease in maternal and child health, HIV treatment for adults and adolescents, and the delivery of primary healthcare services. Graduates, today we celebrate the culmination of an arduous process. And tomorrow, we look forward to watching you as you apply your knowledge, skills, and accumulated wisdom as you ask and answer your own questions. You've dazzled us while you've been here, and we know you will continue to dazzle us as you go out into this world and bring achievements onto global health, implementation science, and metrics. And ultimately, as you become leaders in the field, we ask one thing: don't forget us. We'd love to hear from you. We'd love to collaborate with you, but at a minimum, drop us a line every once in a while, fill out those surveys, and tell us where you are. Now, there's one person who has not yet been thanked who I want to give just a quick shout out to before introducing our student speaker, and that's an individual who has been steadfast in support for our program, Dr. Carrie Farquhar. Whether in her role as leader of training and research grants that have brought students here, as a mentor and chair, committee member for students, as academic chair previously, and now as interim chair, Carrie has always had the success of our students and our program in mind. I can say that this PhD program would not be where it is if it weren't for your contributions, Carrie. Thank you. So now on to this year's student speaker, Orvalho Augusto. I suspect that most of you who know Orvalho do not know that his name translates to morning dew. Apt, as today we recognize washing away the soil and toil of the PhD training with droplets of knowledge gathered through the years, gleaming with bright futures and promise of new beginnings. Now, I've had the distinct honor of working with Orvalho for over 20 years, first in Mozambique and here in Seattle when he joined our MPH program in 2013 and our PhD program in 2015. I can attest that Orvalho's talents are generational. He brings a number of unique perspectives. As a clinician, he understands the challenges patients and providers face in the delivery of primary care in underfunded health systems. He appreciates systems thinking as a pathway to impact of population health. And perhaps what he is best known for amongst the University of Washington community, his talents in study design and statistics. Coupled with his accessible approach to teaching others. Orvalho has been an essential support for so many students, faculty, and staff. Over the past 10 years, he's supported at least 100 MPH and PhD students with tutoring on epi and biostats, as well as faculty on developing analysis plans and analyzing data. Consider this, today, or at least when I looked this morning, he has 98 peer-reviewed manuscripts that have been published. Which is more than I had when I made professor. So on behalf of the MPH and PhD programs, I thank you, Orvalho. And please join me in putting the O in ovation for Orvis.
I was not prepared for that. Thank you. I'm very honored to be delivering this speech for the students in global health metrics and implementation. Oh, there is this device. Oh, hello. That okay. Okay. Looks very dangerous device, but anyways. Thank you. I'm very honored to be delivering the speech for the students in global health metrics and the implementation science. Dear Department of Global Health Chair, faculty, my fellow 2024 graduates, my family, friends, and distinguished guests. Again, I'm honored to be delivering these remarks. Today marks a pivotal moment in our lives. From the few moments ago, we were in the meetings, classrooms, workshops, webinars, and whatever Zoom allowed these days, facing with framework to use and if it would sort out an essential crisis in our dissertation aims. To someone with a degree prepared to maybe conquer or transform the world or just get a better job. Most of us, if not all, I guess, had to make it through the extraordinary challenges, including the reality imposed by COVID-19. What a journey. Well, my journey started in Mozambique, a country that just less than 15 years ago had at least 95% of illiteracy among its adult population. Today, that figure is around 40%, but it's still far worse among women. Many of us, when I say many of us, I mean Mozambicans, face incredible challenge in being able to sit in a classroom. It's still a rare thing to get a degree from a university there. For me, my family, and many of my community, they had to make a sacrifice to put me in a school and eventually get me here. I wish no child on this planet should have to go through all that to be educated. So, as fortunate as I am, it is a huge honor and responsibility to stand before you as a child of Mozambique earning a PhD from the University of Washington. I hope mine and my other graduates' examples inspire young people worldwide with a similar background to feel encouraged to actively pursue the dream of higher education, even when the odds are against them. Now, although we are highly trained practitioners of global health, we still have many things to learn. First, we need to know how to practice humility. Humility, I mean. Second, as important as the rigor of our methods matter, it is not a substitute for careful listening to the communities and to the health workers we seek to support. Those two important lessons are the core to acting for global health equity and universal health care for all humans, including marginalized communities and sustainability of health systems. Being humble and careful listening will help us to elevate the voices of the communities we want to serve, and it will bring them to participate in setting the agenda for all human beings in this planet. Perhaps that way we will set an inclusive and contextual health agenda, contributing to turning our planet into an authentic global village for all. I promise you that this won't be an easy and smooth path. There will be setbacks and endless battles. We must be prepared to persevere. As the old African saying goes, a person is a person because of other people. Let's build a global village using the core values, the best of the tools we learned from our academic environment and the wisdom from the communities we will be serving. I cannot end up praising the DGH. It has worked very hard to welcome students from everywhere and maintain visible diversity despite many adversities, including securing funding. I hope this trend continues as we will be watching. Congratulations, class of 2020.
Thank you, Orvalho. I'm going to ask Kirsten Green to join us to welcome the graduates.
Honored to read your names. As we have been doing, graduates, please stand and move to the aisle to your left. When you come forward, please shake hands with Kenny and hand your hood to your mentor, who will place it over your head. 2 photos will be taken, one of the hooding and one with your mentor after you're hooded. Then please return to your seat after the hooding. Mentors, please come forward when I call your student's name. So this program has 2 tracks. We'll call the metrics track first. Unfortunately, both of our graduates are not here today, but we'd still like to recognize them. Jiawei He, chair with Wei Ku, and Christopher Traeger, chair Robert Reiner. In our implementation science track, I'd like to recognize Nak Chun, who is not here today, and her chair, Grace John Stewart. So now let me call our students who are here, Orvalio Augusto, whose dissertation title is Shedding Light on the Black Box of Delivery, Evaluating the Impact of a Health System Strengthening Intervention in Sofala Province, Mozambique. Chair and hooded by Kenny Scher. Annette Dennis. Dissertation title, Audit and Feedback Strategy in Maternal and Child Health Services in a Low-Resourced Setting, a Process and Impact Evaluation of the IDEAS Strategy in Central Mozambique. Hooded and chaired Kenny Scher. Rena Gorman. Her dissertation title is Increasing the Use of Verification Results Within Performance-Based Financing Programs. Chair and hooded by Gabrielle O'Malley. Hadia Mertash. Dissertation title, Strengthening Respectful Maternity Care During Childbirth Across Various Contexts. Chair and hooded by Kenny Scher. And Melody Wang. Dissertation, From Clinic to Community, Novel Approaches for Decentralizing HIV Service Delivery to Improve Person-Centered Care in South Africa. Chair, Paul Drain, hooded by Kenny Scher. Can we have one more round of applause for these graduates? And now I'd like to invite Carrie Farquhar back to the stage.
Oh. So as you can see, something special is going to happen again. So I just have very few closing remarks. One is that there is an amazing reception outside. So we would like all of you just to head out. I don't think you'll be able to miss it. 2, if you want to take pictures, there's a place there for selfies and pictures with your family. 3, we're about to see a video, which will be 3 or 4 minutes long. And the 4th is actually just from me, a big congratulations to all the graduates, and thank you to all the graduate speakers. That was really, truly touching, very thoughtful, everything that each of you said, and that I think will stick with me for a long time. So thank you for that. And oh, I do have one more thing, sorry, one more thing, very importantly. the communications staff, Letty and Monica, big thanks for supporting this. And if you liked the first video, comes another video, and Chris Joss is in the back of the room and is the one who put that together. So thank you very much and enjoy.
Congratulations, you made your dreams come true. Dr. Raquel Sanchez, we're so proud of you.
We love you, Santa Munoz kids.